Well, joining me now are three MPs from different parties. Adam Van Koeverden is a Parliamentary Secretary and the Liberal MP for the Ontario riding of Milton. Garnett Genuis is a Conservative MP for the Alberta riding of Sherwood Park, Fort Saskatchewan. And Jenny Kwan is a NDP Deputy Health Critic and MP for Vancouver East. All three of you, thanks for joining us.
It's great to be with you today.
Okay, well, let's start with the opposition motion, which was debated all day yesterday. It's a motion from the Conservatives calling on the government to issue a report by Wednesday, December the 16th. In that report, there would be timelines for the arrival of vaccines in Canada, dates for their distribution, vaccination schedules, and criteria for the government to determine who gets the first limited number of doses. Adam Van Koeverden, can your government and will your government provide such a report?
Absolutely, we have a plan, and we've been working very, very closely with stakeholders across the country, including provinces and the armed forces. So not only do we have a plan, but we are ensuring that it's well rehearsed and seamless. We're working closely as well with international bodies and with the producers of these vaccines. And yes, we're more than happy to provide all pertinent information, as we have been. I should say there have been briefing calls and technical calls on a weekly basis for everybody the media as well as opposition members. So we debated the bill yesterday, or the motion yesterday, and I do believe that we'll be providing more information as we have been.
Okay, one question which still remains to be answered. I'm going to get to your opposition colleagues, but one question, a simple one, which still remains to be answered, and that is what is the date for the first vaccines arriving in Canada? We still don't have that. Do we have that yet?
Well, we don't, because the Health Canada regulators have not approved the vaccine yet, and that is the first step. And as a politician, I will always rely on scientists and regulators and experts, not political motivations to have these things done. It's very important that we rely on experts, as we have been from the beginning of COVID-19, because we are blessed in Canada with great academics and experts across a variety of immunology and virology fields that are guiding all of our decisions.
Okay, Garnett Genuis, is it realistic to ask for the level of specificity that you're asking for? You're even asking for vaccination timetables in this motion. Is this overkill, or is the government actually able to provide all of this information that you request in this motion?
I think it's very important, especially during a time of pandemic, that the government be communicating clearly with Canadians, including the information that we put forward. In some ways, it's unfortunate that as an opposition, we have to use opposition day motions as a way to compel the government to disclose information which they should be disclosing anyways. There's been a lot of discussion about the need to build awareness and build confidence around public health measures. The way to do that is for the government to be transparent. And we have seen a lot of mixed messages when it comes to vaccination timelines. Back in August, Minister Baines was saying it would be sometime this fall, and then we've just been all over the map ever since then in terms of when exactly this is going to roll out. And I appreciate the point, and nobody's going to disagree with the point that there needs to be a robust approval process by independent experts first. I think what Canadians are asking is when they look at approval processes in other jurisdictions, and that's true around testing as well, that we have rapid and at-home tests that have been approved in other jurisdictions that haven't been approved here. We need those independent approval processes, but Canadians are right to ask questions if they're seeing things approved in other jurisdictions with similar standards, and those things are not approved here. When timelines are being set in other jurisdictions about when people living in the U.S., the U.K. are going to be able to get access to vaccinations, and when those same timelines aren't being set here. So the processes have to be independent, but if Canadians are at the back of the line, if Canadians are behind people in other countries, that's where I think that raises red flags for people.
Jenny Kwan, will the NDP caucus vote for this motion? And if it passes, obviously in a minority parliament, if all opposition parties vote for it, it'll pass, and then you'll have an official call on the government to provide all this information. Will you vote for it, and do you think it's realistic to ask all of these things?
Well, the NDP supports the motion. I think it is very important for the Canadian government, for the Liberals, to be forthcoming and be transparent for Canadians. Canadians are so worried about what's going to happen. When will they get the vaccine? They're watching the numbers go up day by day, right? The impact's been very, very significant. And the only information we got so far has been conflicting information, different dates, different timelines that different government officials and ministers had provided. The other thing that Canadians are asking asking is this: why aren't we prepared to manufacture our own vaccine? In fact, Garnett Labs used to be a world-class, world-recognized, publicly owned entity that produced vaccines and prescription drugs for Canadians. And of course, it was the Mulroney government under the Conservatives that privatized it. Now, that was back in 1986. And so moving forward to today, we seem to not be able to move forward to bringing back a Canadian manufacturer, and we're behind relative to other countries. Other countries are able to produce their own vaccine: Germany, India, China, Brazil, US, UK, etc. But then Canada is left behind. And so we're behind the 8 ball all the time. So the NDP is also calling for the Liberals to actually bring back a Crown Corporation, a publicly owned entity, if you will, and manufacturer, so that we can ensure that we deal with these kinds of crises going forward.
Okay, Adam Van Koeverden, I want to ask you something else. We got news from Pfizer, the international pharmaceutical company Pfizer, that it will only be able to deliver about half of its previously announced amounts of vaccine before the end of the year. So that concerns this year. But it does raise questions about the supply that the Canadian government is counting on getting. We're supposed to be receiving up to 4 million doses from Pfizer by the end of March. Do you know if this announcement might affect expectations here in Canada of how much we'll receive from them between January and March?
That's a very good question, and it's troubling news out of Pfizer this morning. But because we have such a robust portfolio of vaccines, we have 7 now that we can exercise options with. We don't anticipate that the news that we heard today will have an impact on the number of vaccines that we will receive from Pfizer. But we are also exercising options with Moderna to receive an additional 20 million vaccines, bringing that number up to 40 million vaccines. So the reason that we have such a diverse portfolio is so that we can rely on multiple sources, because none of them are a guarantee. And before I stop there, I just wanted to say that I'm really, really glad that both of my colleagues today are talking about the importance of good information. Because as many of the members of the Conservative Party have been asking for more information, other members have been peddling misinformation. And I brought this up yesterday in the House of Commons because I think it's really important. We all have platforms as elected officials. People rely on us for really, really good, reliable information that helps Canadians. And I think we have a duty to do just that. We are a method of communications for our constituents. But lately, members of the Conservative Party have been sponsoring petitions questioning the effectiveness and the efficacy and the health of vaccines, calling it human experimentation. I've seen members from Alberta talking about questioning the legitimacy of numbers and deaths. And then just last week, I heard a radio interview with a Conservative member from Niagara comparing COVID-19 to the seasonal influenza.
Did you present a readout
and
of
this
this discussion already?
Okay,
and it's really troubling. It's really troubling that members of the Conservative Party are not willing to call their colleagues out, members of their own party, when they're misleading Canadians, and that's what we're seeing right now.
Okay, on that, I'll have to let Garnett Genuis weigh in on that. What do you make of? I mean, we did have one person tabling a petition which called the advanced speed vaccination, a human experiment, and all that. But what do you make of those accusations?
So I think it's important to underline that in May of this year, Ron McKinnon, the Liberal chair of the Health Committee, sponsored petition 2424, and that was an e-petition that raised concerns about the negative impacts of cell towers on children. And at the time, the Liberal chair of the Health Committee
right now,
said,
Garnett,
let me finish.
Hold on, one at a time. So your point is?
The Liberal chair of the Health Committee said at the time that he sponsored the petition, even though he didn't agree with it, because people in his riding had asked him to. Now, without commenting on Mr. McKinnon's petition or Mr. Sloan's petition, I do think that if a line like that, if the statement that they were responding to their constituents, even though they didn't necessarily agree with it, if that line was good enough for the Liberal chair of the Health Committee, and if Mr. Van Koeverden didn't call out Ron McKinnon at that time, then it's interesting now that he's wanting to call
Yeah, I
out
don't recall
people
there being
on the other side of the
cell
aisle.
phone towers there.
Okay, so,
I think
I'd also note that you
there's
seem
a
very well
question.
prepared
Okay, on that-
to not
on that
answer the
question about
as to whether or not
the
you find
appropriateness
Mr.
of
Sloan's petition
signing
legitimate.
petitions
sorry.
or sponsoring petitions, but there's clearly a double standard.
So
in
the
terms
point
of
is it's about
partisanship.
petitions. Okay.
Again, this isn't
You're
just an
comparing- now you're
individual
comparing
member of
COVID-19 to
Parliament.
cell phone
This is the
towers.
chair of the Health
That
Committee.
wasn't the question.
Right? that
Okay,
signed a petition.
I've been told that we're out of time, but I want to thank you both. The point about petitions is an interesting one. We are out of time, but I want to thank all three of you for taking part. Thanks a lot.
Thank you.
Thank you.